Okay, so let's talk about progesterone and low implantation rates. I'm Dr. Nina Vyas, a reproductive endocrinologist and infertility specialist with California Fertility Partners, part of the Pinnacle Fertility Network. So first, let's talk about progesterone. Progesterone is released from our post-ovulatory cyst called your corpus luteum. This progesterone stabilizes the lining, allowing for an embryo to implant. If implantation is successful, you release HCG from the embryo, which is the pregnancy test that we take, is checking for HCG. But this HCG tells your post-ovulation cyst to keep making progesterone. So it's a cycle that keeps going. The progesterone supports the embryo and so on and so forth for the full first trimester. After the first trimester, the placenta starts to make progesterone on its own, and the post-ovulatory cyst dies off. So you can imagine progestation, right? Progesterone is such an important hormone in pregnancy, and so it's often under scrutiny as to a reason why embryos don't implant or why patients have unsuccessful pregnancy attempts. However, there's so much more that goes into successful implantation, such as genetic normalcy of the embryo, uterine factors such as polyps, scar tissue, fibroids, septums. It's really important to rule out all of those things before just looking at progesterone alone, because we see progesterone as more of a symptom of low implantation, because if you don't have successful implantation, the HCG is not going to rise, and therefore you're not going to release more progesterone as a cyclic cycle. Of course, there are some treatment cycles that require progesterone supplementation, and this is going to be through intramuscular progesterone or vaginal capsules. And oftentimes that supplementation is given because you are not making progesterone on your own, because you did not ovulate in that cycle, because we controlled your cycle that month. So if you have low implantation or failed implantation, make sure that you're going through the workup to really understand why that is and any medical reasons behind it, instead of just thinking about the progesterone alone, even though the progesterone is an important component.